Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NLBHA for short. Thank you for joining us today for our series called Pláticas, Latino Wellness During COVID-19. NLBHA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. NLBHA is excited to host this Facebook Live series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. Joining me today as my co-host is Dr. Susie Villalobos, who will introduce herself shortly. I'd like to thank our strategic partner, Morehouse University School of Medicine, for helping make this series possible. Each month in 2021, NLBHA will host a professional expert or a group of experts, like today, to talk about public health, behavioral health, and the field of medicine, as well as those individuals who may join us on the live book audience participants, such as community members, advocates, and other practitioners and professionals. Today, our panel of experts will share their insights and experience and their expertise on how to take care of yourself and your family during COVID-19, but particularly, they'll be focusing on their phenomenal work in the Paso del Norte region, specifically in El Paso County. We want to say we're so grateful here at NLBHA for their expertise, for taking time to share it and to impart their wisdom, their knowledge, and of course, about the work that they're actually doing. Today, this powerful guest panel speakers are just phenomenal. They're going to be able to share with us things that will help us learn about their work in their respective organizations and in their practice and what has happened to really change the circumstances in El Paso from a year ago to the present, given that we have just completed 1 year cycle of experiencing this pandemic here in the United States. To get us started, here's how the Plática works. I and my co-host will have a series of questions, and she and I will take turns asking questions of our panelists, and we'll provide them an opportunity to comment. And we're going to encourage the live Facebook audience to actually send us some questions so we could ask the panelists your questions. Or if you have a comment or you want to express a concern about things you're seeing or hearing, please put them in the chat, and then we'd like to be able to share and impart those to our panelists during the course of our session. So here's what's going to happen next. We're going to get started, and we're going to ask, of course, that our co-host introduce herself and our presenters. So Susie, I'm turning it over to you, and after that, we'll get started. Go ahead.
Thank you, Fred. Thank you for having me today. It just seems unreal. It's been a year, and you and I did our first Plática in this series, and I feel like we've come full circle, and we are definitely in a better place than we were a year ago. So again, my name is Dr. Susie Villalobos. I'm a research director in El Paso, Texas, and I have the honor of introducing our esteemed guests, whom two of them I have worked with very closely. I have worked with Dr. Fernando González, and I have also worked with Dr. Alozie at Texas Tech Health Sciences Center when he was doing his work in HIV. So I'm going to go ahead and introduce our three presenters. I'm going to just give you a little bit of information in the phenomenal work, as Fred mentioned, that they're doing in El Paso. So first, I'm going to introduce Dr. Elizabeth Robles. She's an LPC, and she works in the El Paso region as a behavioral health professional, treating a wide variety of issues and disorders with specialties in life changes, trauma, grief, and loss. She has worked as a licensed professional counselor in Texas since 2013. Understanding that Mexican Americans have unique beliefs and practices about death that are based in an ancient cultura, she brings to her therapeutic practice a profound understanding that death serves the vital role of making life more meaningful. She is a longtime advocate for behavioral health and community service, and Elizabeth has participated in many efforts to increase access to care. She served as co-chair of the Senate District 29 Healthcare Advisory Committee from 2014 to 2018, and she was also a member of the Southwest Regional Health Equity Council an effort of the Office of Minority Health. So welcome, Elizabeth, to our panel today. Also today with us, we have Dr. Alozie, who is a superstar in El Paso, Texas, because he is pretty much on television every night. He's been on CNN, he's been on NPR, he has done several interviews with regard to the pandemic in our region. And we owe him a debt of gratitude for really getting the information out to us in real time. So Dr. Alozie is a graduate of the University of Minnesota's Infectious Disease Fellowship Program. Prior to this, he received his medical degree from the University of Benin in Nigeria, and then completed an internship and residency at the Hennepin County Medical Center in Minneapolis, Minnesota, where he got his introduction to digital health. He is a board-certified clinical informatics by the American Board of Preventive Medicine, making him one of less than 100 such certified physicians in the state of Texas. Currently, he is the chair and co-chair and member of multiple state committees. He represents El Paso, focused on how health information technology can improve care. He gave a TEDx El Paso talk titled The Digital Immigrant in 2016, and in the same year was awarded Best Doctor in the City by El Paso City Magazine. In 2017, the El Paso Pharmacy Association gave his clinic the award for innovative practice. Welcome, Dr. Alozie, to our panel. And last but not least, my friend, Dr. Fernando González. He has 35 years experience managing public health programs and projects in the United States and in Mexico. Currently, Dr. González collaborates as senior consultant with Links Global. Links Global offers business management, consulting services, marketing communication, and digital technology in the US, Africa, Asia, and Latin America. He graduated from medical school in the University of Ciudad Juárez in Mexico and received an MPH degree from the School of Public Health, the University of Texas at Houston. He has also worked with the United States-Mexico Board of Health Association, the Texas Department of Health Binational TV programs, the College of Health Sciences of UTEP, and the Ministry of Health in Mexico. Welcome, Dr. González. Okay, Fred, so I think we have reached a part where we're going to start with our questions.
Awesome. Thank you, Dr. Villalobos. Well, what an esteemed panel. And with the questions that we have, I get so excited that I want to have you answer them all right away. But we're going to start with the first question. And as I ask you all the same first question, please feel free to say a little bit more about yourself if you'd like. So if there's something you'd like to add to our introductory remarks, please feel free to do that. It will be very enlightening to have you share some of that. So since we are just a little past the 1-year mark from when COVID presented itself across the United States, I'd like to hear from your perspective, and this is a question for each of you, is for you to describe from your perspective what you believe have been some of the challenges facing El Paso ever since the first case was diagnosed more than a year ago. So I'm going to start with Dr. González. Go ahead, sir.
Thank you very much, sir. Again, thank you for having me. Dr. Villalobos, you were critical for me to be here, and I appreciate your facilitation for me to attend and participate. Well, I think I need to go back a little bit before the first case appeared here in El Paso, because we were following this event that was developing in another continent, in China precisely. And we have not a very clear idea on what was going on there, but you know, the numbers were tremendously worrying. And so we started, you know, worrying by the end of 2019 and starting working, you know, trying to get ready, reading, preparing, activities, training, learning more about the disease. So also we prioritized communication with our neighbors in Mexico, very close neighbors, and of course with New Mexico, Las Cruces in New Mexico, Department of Health. And we're discussing, you know, how are you doing? Do you have the first case? What's going on? What are you expecting? How are you preparing yourselves? So basically, was all the planning process in order to get. Once we got the notice that we had the first case, Paso wasn't a surprise, but it came kind of a cold water shower, because nobody wanted to have this monster in their backs. So we started like that. Challenges, we knew that the condition of our community, as well as in our neighbors in Mexico and New Mexico, and worry some situations like the chronic diseases, the social and economic situation of some sectors in our communities. And, one of the biggest challenges that I think we encountered early was the misinformation and miscommunication. This produced in some way fear in our community. So to gather all the information and process it to make it, all the messaging to be clear, concise, concrete, and understandable took a while. And we started selecting or organizing by sectors, by age groups, the messaging, the communication, in order for each of the individuals in our community to have the right information at the right time. So always having a international crossing, 2 nations, 2 systems, 3 states that not even share a same surveillance system. They're different, following the same purpose, but still different systems poses a challenge. So, that there was in general the areas that I recall having profound concern and seeing the numbers, increasing, the hospitalizations, and, later the deaths appearing. But we were there, and all the sectors participated. I think, I'm sure that Dr. Alozie and our colleague Robles will expand on the services that they lead during this time.
Thank you, Dr. González. Yeah, thank you for putting in perspective that the medical community, in its anticipation and preparation for what they were reading and learning very early on, was already signaling to you, as you said, and I appreciate your describing it very candidly. And that was to describe it as the worry that the medical professionals had. In a study done by the University of Chicago through the National Opinion Research Center, in their conducting formative research, they found that the one adjective that described how communities of color were experiencing this response to the news and the information was they were worried. And so it parallels that the professionals, just as those of us in the community who are hearing this information, were saying, expressing the very same thing. So I want you to know that I don't think they interviewed you for that research study, but you are in fact validating, and they're validating in return, something that was of great concern, and it affects the well-being of Latinos for sure. And with that, I'm going to segue to Elizabeth Robles, my esteemed colleague from the beautiful city of El Paso, and I've just been so delighted to see her work. She's one of the most phenomenal community advocates I have seen, know, and appreciate the work that she's done. She speaks in a way that really is very telling of her commitment and work in the community of El Paso, and certainly the region. With that, Elizabeth, the same question to you is, now looking back, what have you seen as some of the challenges facing the individuals, the communities, the residents, our families in the El Paso region? What have you seen and confronted during that period of time?
Sure. Thank you, Fred. Well, I'm in the trenches. I think we all are in a different way. I am in private practice, and I am very familiar with the community because I've done a lot of community work. I've worked in a number of agencies in the past. Before I was actually a therapist. This is my second career, and I'm very aware of the needs that we have in our community. And I think one of the biggest issues that was plaguing just all of us, as I would hear and I would listen to people, is the uncertainty, the lack of the fact that we did not know the magnitude of this, that we did not know the impact, and that there's a sense of resisting and saying, you know, we want to separate it from ourselves, and this is not personal. It's not going to affect me. It's not going to happen to me. It's not going to happen to my loved ones. It's something that's in China. You know, China's very far away. And though we know that our world keeps getting smaller and smaller, that whole perception is a defense mechanism that people were using very often as a way to say, everything is status quo, I'm okay, my family's okay. And then as we started seeing the numbers grow to a point where we were one of the hotspots in the country, and how devastating that was, and the impact, it was truly, I can almost chart the changes that I saw as I spoke, and I used the, you know, the video counseling with the community, how everything started progressing into moments of true panic and hysteria and just constant fear, and then trauma of losing loved ones, of having, for example, when we had the refrigerated morgues that were parked in the city, what a devastating scene it was for the community, and coming to terms with, how do I help myself and protect people? One of the things that I want to mention is that I am one of the co-founders of a 501c3, a nonprofit organization here in El Paso that started its origin through the office of Senator Jose Rodriguez, and it is called Mano y Corazon NYC Institute of Integrative Health. And our mission there is to educate and promote awareness of health equity, health literacy, to the community at large, and to train professionals in these topics. And so one of the things that we did was we surveyed 500 people who have attended other events that we have had, either Pláticas, person to person, pre-COVID. And we saw that there was a few very important things that people were talking about. One is, how do I protect my family? How is it that I deal with this uncertainty? Like, what's going to happen next? Who's going to tell me? Who's that guiding light? The third was the depression, and of course, the grief. And so in those 500 people that we surveyed, we got those high points. And so we saw the prevalence of all these issues and how they were shaping and impacting every individual and family systems. And the reality that whole myth of, this is not going to happen to me, this is going to happen to somebody else, was no longer true. And so I think that's one of the biggest challenges that we were dealing with, that concept of coming to terms with. And we know that as a community, there's areas that lack the availability to have information that Dr. González and Dr. Villalobos and Dr. Alozie are putting out. We're a very big community, but yet the systems, because of the challenges we have, socioeconomic, et cetera, are not going to trickle down. So people were very disempowered as to how to work through this horrible phenomena.
That's excellent. Thank you, Elizabeth, for, describing the impact it had in your community. Because I love the way you said it. You know, when you're the boots on the ground, this is what you see, you hear, this is what you're touching on a daily basis. And, you know, we're going to learn more about you during the course of this interview, by the way, because you have specialized training that's very specific to the very issues that we have seen Latino struggle in our country, and that is death and dying, grief issues. And so please, later during the course of the interviews, please speak to that training and your work. And so I'd like to turn to Dr. Alozie and ask you the same question, Dr. Alozie, about, since the inception of this pandemic in El Paso and your direct experience with what you have seen as a physician, you know, we certainly know you firsthand are dealing with things that often the majority of our communities don't see, don't feel, don't experience. But I have to tell you, I did get to watch you on a television broadcast that was telecast on Facebook, and that's how I learned about you. So it was no surprise that Dr. Villalobos said, "Oh, I know who we should invite for this Plática." And lo and behold, you're here today. Thank you. You're wearing your scrubs, so that already tells us something. You're probably ready to bolt and serve your clients. But sir, let me turn it over to you with that first question, and then we'll go to Susie after that.
Yeah, absolutely. Well, first of all, thank you for having me, and thank you for everybody that put this together. I think it's an important conversation to have. I mean, the last 12 months have been sort of breathtaking in so many ways, and not always in a good way. A lot of times, if something's taking your breath away, you hope it's good. Either it's love, or you've gone to the gym, you're getting healthier. But sort of the impact to this community is something that we'll probably be talking about for years to come, right? I think there'll probably be a post-mortem or books written about it. When I sort of look at 2020 and how it affected our community, I really look at it as three phases. The phase that Dr. González talked about, which was the sort of denial, it's not going to come here. And I remember really clearly being on a host of sort of talk shows and saying, well, we're blessed right now because we're geographically isolated. In fact, myself and Dr. González, excuse me, on an event where we said we're geographically isolated, and that's what's keeping the virus away from us. The next phase was actually the phase of spread. And unfortunately, that was spread 1A and 1B. It was the July-August phase where all of the Southwest was really hot, Arizona, ourselves, and Florida. And unfortunately for us, we had this lull period in the middle where we just thought things had gotten better. We had survived our first sort of surge and would never come back. And unfortunately, we were hit by something even more devastating. And I think Ms. Robles really talked to that in terms of the denial and the death around it that happened to us in November and December. Excuse me. And we're still dealing with a lot of that, right? I mean, it's a blessing that the cases, hospitalizations, and deaths are coming down, but we will be dealing with the postmortem and the sort of psychological effects of that for some time to come. And so as we're here today, right, I've been saying this a lot, the only way to give honor to those that passed and the families that went through all this turmoil is to do what we're proud of right now and be the best city in Texas for vaccinations. And so I think that's exciting. And hopefully we can talk about that as we go forward.
That's wonderful. Yeah, I think you're absolutely right, Dr. Alozie, because in this spell of darkness, there have been many experiences of just very mobilized, effective, and healing efforts to take care of members of our respective communities. And El Paso really stands out, certainly in my perspective. And there's the data to show it. There's the experts. There's the community mobilization that's taking place. And I just think you're absolutely spot on. So I'm going to turn to my co-host, Dr. Villalobos, with the next question. And just after we're completed with that question, we're going to do some shout outs for some of the folks that are on live Facebook right now who are already commenting, and we're starting to see questions coming in. But Dr. Villalobos, turn it over to you.
Yes, well, thank you for answering that first question. Very insightful and different responses from all three of you. And I think, Elizabeth, you hit it right on the head with the misinformation. And from a personal experience, I was also wondering where and how to protect myself and my family and seeking a leader and information. And I stumbled upon Dr. Alozie speaking on whether it was a talk show or whether it was a one-on-one interview. And I started following him because some of the information that he was providing made much more sense than some of the information that the federal government was giving at that time in terms of language, in terms of testing, in terms of how significant it was in El Paso. And we became a hotspot early on, unfortunately, during the pandemic. So that was probably one of the scariest times for me personally, protecting myself and my family, because I have a young son, and then I still am lucky to still have my parents. So that misinformation was a very big deal. And like Dr. Alozie said, we'll probably be talking about it for years to come. So with that, I'm going to go ahead and ask the second question, and I'll go ahead and pose it, whoever wants to answer first, if that's okay. What type of ethnic disparities are specific to El Paso that have prevented many from receiving either the vaccine, from testing, or from receiving medical care? Who wants to go first on that one?
Well, if I may, I would like to give some stats, not all the good thing that I want to talk about, but let's put it on the table to discuss later. But you have to remember that in El Paso, we still have 70 to 80,000 people living in settings that are underserved. The famous colonias have been here along the US-Mexico border for a long, long time. All the colonias now have better services, or no, not better services, but services, basic services like water, like sewage, and they have progressed a little bit. But newer settings of this type are still popping up, and sometimes they have become smaller in population and with more difficult access. Knowing that 20% of the population of Paso lives below the poverty level, adults still in a high percentage without health insurance, up to 35% in groups like 16 to 64. Some El Pasoans are unable to see a doctor up to 20%, at least one time a year. And Ms. Robles, you know this, and Dr. Alozie, well, you master on this information and stats. And as well as you, Dr. Villalobos, poverty, the health insurance, mental distress, mental situations have increased tremendously. And you can see it with even with your close ones, with friends, with relatives, and, fear, anguish, a lot of feelings that weren't there before this happened. And of course, we need to live with the chronic diseases that we already discussed that pose a big challenge for the healthcare services, and even infectious diseases. And having the expert of HIV here, we don't have the better place regarding HIV and AIDS in our city, neither in tuberculosis or other diseases that still are there and that pose a real challenge when we're talking about well-being in the community. So mainly that was my comment.
Thank you, Dr. González. Elizabeth, do you want to go ahead and, I see that you want to chime in.
I agree 100% with Dr. González. The challenges regarding mental health are unmeasurable, I think, at this point. I can honestly say that as a healthcare provider of behavioral health services, as a clinician, I feel strongly that the pandemic that we're already in and that we're looking into very heavily is behavioral health, is mental health, because of all the situations that Dr. both Alozie and González and yourself, that we all know, all the challenges that we're up against. And the other thing is, in terms of the disparities in our particular population, I have clients that are in the colonias and that had the COVID and gave it to their son, and there was 5 or 6 or 8 people who had it in a household, and none of them would go see the doctor. And I had to really divert my mental health work to psychoeducation regarding these are the reasons why you have got to see a physician, or call them and let them know that you're sick, that you have COVID. Did you took and even just taking the test, because a lot of them would say, well, I already have it and I'm going to get through it and I feel okay and I'm not going to go anywhere because I'm just going to write it out, and the whole write it out. But I had to do a lot of explaining of the sequelae regarding COVID, how we don't know a lot of the information and what could be more damaging. I know a young woman who is a nurse, and the husband was nursing the COVID at home, thinking he was going to be all right. Young man, 33, he had 3 heart attacks and died in front of her in her bedroom. And so there's always that lag, because there's so many challenges to accessing healthcare, that we have this it's almost a social cultural aspect of, I'm going to let it happen, I'm going to be okay, I'm going to take the teas and the this and that, and they help, but we know that that is obviously not enough. So those disparities have the hardest, most detrimental impact to our community, because of the fact that we do not have that access to healthcare, to proper healthcare. So it was constant. And as we were talking about those months that we were the hotspot, it was daily deaths. It got to a point where first it was daily having clients who had the COVID, and then it was daily two, three people have died, 4 people have died, 7 people have died, 3 people have died. It was a constant slam to mental health. And I speak for myself and all my colleagues, and we were saying, well, usually something's happening to a group of people, like the unfortunate events we have of the terrorist attack in August the 3rd, but we were not affected maybe directly. We were affected indirectly. Here, we were all affected. So again, who's the authority? And we were all praying to Santo Dr. Alozie to give us the information that we needed, and that was going to be a light at the end of the tunnel somehow. But absolutely, the disparities have created tremendous impact to our colonias, to our lower socioeconomic areas of the community, without a doubt.
I like that. I think I'm going to put that on a T-shirt, Santo Alozie.
Yeah, I'll buy one.
Thank you. Dr. Alozie, to you, sir.
I mean, so first of all, no T-shirts.
Okay.
Secondly, I mean, it's just a lot, right? I think there's a lot to unpack. And I'm going to focus on the positives, not to discount the negatives, but I think it's important to take away some of the nuggets of what we did great. And what I will ever and eternally be proud in our community about is how we came together, right? And there may be political discord, but when we sat down, one hospital with another hospital with another hospital, the city, the county, the public health players in the city, whether the FQHCs, private doctors, whomever it was always targeted at trying to do the best thing possible. How can we get information out to our community? How can we ensure that the lines are shorter to get tested? How do we let people know that they can get tested? One of the proudest moments I have is when we sort of came together on our COVID-19 task force and created the dashboard, the El Paso Strong dashboard, right? And people could go there in a transparent manner. And I thought that was critically important, that there was transparent ability to see the data. And so you didn't have to be on an email list. You didn't have to have access to the news. And I get it, or don't get me wrong. I mean, as a digital immigrant and somebody that came from a third world country and is blessed to be where I am now, I get that not everybody has internet, but at least there was a place where you could see all that. And I'm just as proud when I look at it on my right screen over here to see that the vaccine information is there by zip code, by demographics. And those are the things that when we came together, and even in some of our darkest times, that November, December period where we had FEMA and DOD and tents and all the rest, even then, all the hospitals, the city, the county, the state, there was an open line of communication in an attempt to get the right thing done. And shameless plug for Paso del Norte Foundation and FIX, the HIE, our Health Information Exchange, immensely critical to the ability of the clinical networks in this community to be able to talk to each other and see data. I think without that, we would not have been able to do some of the things we did around moving of patients, getting patients to our alternative care site. And so for the naysayers that a decade ago, I remember when we had some of those meetings that said that an HIE wasn't important, critically important for the community and other communities that haven't jumped on board. In the 21st century of healthcare, if your community doesn't have an HIE, you've crippled yourself already. And so I think that's a kind of shameless plug there. And I'll stop talking because you let me talk, I could talk for another hour. That's not the plan.
Thank you, Dr. Alozie.
Well, that's wonderful. Yeah, thank you, Dr. Alozie, for your comments. And you're absolutely right. When you're impassioned by what your community needs and your desire to respond to the community, that's what happens is we take all of our energy to be able to address those issues. And so I want to just for a moment, we're already kind of halfway through the program and things are just moving so quickly that I would be remiss not to take an opportunity to do some shout outs for folks who are joining us live on Facebook. So let me just take a moment to acknowledge some of our listening audience members. And then we have several questions that have come in that I do want to use one of those questions as part of this dialogue because it's important for us to take an opportunity to respond to our listening audience. So I want to very quickly shout out to Corinne, Eva, Valkyria. We also have Jonathan with us, Rick, Maxine, David, Dietz. We have, let me look through here, and a couple other folks who are watching without asking comments or questions. So kudos for you for joining us today. And I'm going to pull one of these particular questions out. And I think you all kind of touched on this earlier, the issue about information versus misinformation. But what we're going to do now is talk about the messaging that is taking place, that is productive and that is helpful and informative, because in some measures, El Paso is unique for lots of reasons, right? Most people don't know that almost 75 to 80% of the population in El Paso proper are Hispanics, right? So that tells you that you're going to have a large percentage of English or Spanish speakers, and you're going to have some folks with less limited English proficiency. But overall, what you're finding is that the messaging should be culturally and linguistically appropriate. And so the question that was asked by one of our listening audience was the following. He wants to know, are there any public health information campaigns, either utilizing social media and or commercial outreach, that can be done to better inform at-risk populations and those currently unwilling or skeptical to get vaccinated? So if I can, I'm going to, I think this is a question that I'll direct to Elizabeth, and then I'm going to go back to you, Dr. Villalobos. So Elizabeth, this is one of your cup of teas. MYC is doing something that I have to tell you, I boast about anywhere I can boast about it. Manuel Corazon Institute has actually done some incredible work that is by, for, and about Latinos. And the significance of that is that we're demonstrating how we talk to our community in the way that we phrase things, the way that we say them, our choice of words and the images, and the importance of how we ourselves are joining these campaigns. So can you speak a little bit to this, and then we'll go to Dr. Villalobos.
Sure, Fred. One of the things that we know and that I have seen in the community as I worked throughout different areas is that word of mouth is perhaps one of the most powerful things that we have in El Paso County. I think it works in a lot of places, but I definitely think that here, looking at areas that do not have so much access, looking at the fact that there is a lot of migration and people have a lot of things in common, they're going to take care of themselves. They're going to watch out for each other. They're going to inform. And so one of the things that we decided at MYC Institute of Integrative Health is that we wanted to do very culturally relevant messages that were very short and that would capture the audience that we needed. So we designed, Corinne Chacon, who's the executive director, she is also a graphic design artist, so that helps out a lot because we multitask in different ways. But we came up with a short version, and maybe she can tell us about it right now. She can write it out, but it's la cultura cura y la vacuna. Fred, help me out with that one. Y la vacuna asegura. Yes, that was the part I was missing. So the vaccine, our culture cures and our vaccine assures. And so we had different designs that would help kind of identify like the typical Mexican heart that's made of metal, that is embossed, things like that. And we've made them t-shirts, we made them short clips that could go out on media, social media, Facebook, Instagram, etc. The other thing is that we made short videos that you all can access through YouTube under MYC Institute. And they're basically short, either 2-minute or 5-minute videos that talk about the messaging of protect yourself, protect your family, kindness works. This is where we all come together. Some of them have pictures of El Paso, of familia, of gathering, especially during the holidays. We really wanted to take the messaging of don't gather this year so we can all gather next year. And so that whole holding back and safe distancing and doing all this, we really try to come up with as much as possible. The last video that we did was maybe, I'm going to say 3 weeks ago. We went to San Elizario. The community came together. We asked about 25 different people, young, moms with babies, gentlemen, and they were holding up the sign that was in Spanish, and they would say a sentence in English. So maybe someone needs a smile today, or get the vaccine because it saves your lives and your families, etc. And so we are always trying to integrate the community, because the community itself relates to the rest of us and to what Fred just mentioned. And Fred, in his constant teaching to us, because he is a jewel as well in this whole panel, he talked about permeability and how people in our community, we have been here for a long time. We have created our lives. We have generations, and those generations are interwoven, much more than interconnected. They're interwoven to pass on the information, to support each other, and to understand why maybe making these sacrifices of not being together, of social distancing, etc., is so important. Right now, the big deal is vaccinate, vaccinate, vaccinate. And so those are some of the things that we have been doing at NYC to continue that, and to have it in all kinds of ways, because it's going to attract a number of people. It just can't be focused for mommy. It can't be focused just for grandma or for that 45-year-old, professional. We needed to direct its message to grandpas and to dad and etc. So we always are very culturally aware of what is happening in our community and what sticks, what messages can come about.
Yeah, just so powerful. All I could say is I'm inspired by that work, and I'm trying to inspire others to learn about that work. But also, to the gentleman's question, I'd encourage people to visit our website and our Facebook page to see all the other campaigns that we're associated with or trying to facilitate that we believe are culturally and linguistically appropriate for Latino populations across the United States. And that's the whole spectrum. So, my God, all I could say is, Susie, we could stay here for about another hour, right? If they let us loose, if the producer would let us keep going on, right? But in the absence of that, I'd like to do a couple of things so I can get back to Dr. Villalobos. Let's ask one more question of our panelists so that they all have each an opportunity to respond to one question that Dr. Villalobos will ask. And then we're going to conclude with some closing remarks by each of the panel members. We'll have just enough time to hear from them still, because what we're hearing on the chat, by the way, I want you to know, is folks are responding very positively. I'll just say something like this. Valkyra said, yes, proud, and she has an exclamation mark next to it. Dr. Alozie, right on. People came together and we became created. Proud of all those who jumped in and creative, innovative networks. And someone says here, we need to be loud about death and dying, speaking about how grief has impacted us. And I hope, Elizabeth, you'll speak to that. We have another who's acknowledging Dr. Robles's comments and Dr. Gonzalez's comments. So you're getting some really favorable comments by people who are appreciative of your being here today, sharing this, and in the way that they said it, they appreciate the plática. So it's not overly scientific, not using a lot of medical terminology, because people can relate to that. And I've always said to my colleagues across the nation, simple messaging is actually very powerful if you can master how to say things succinctly, precisely, in a way doesn't overcomplicate the subject matter. So kudos to all of you. So Dr. Villalobos, we'll turn to you for the last panel question, and then we'll go to closing comments. So Dr. Villalobos, please.
Yes, thank you. Thank you, Elizabeth, Dr. Alozie, and Dr. Gonzalez again for being here. I think in hearing all of the comments from Fred and in the chat, and also from the conversations that we're having, El Paso did come together in one of the darkest times during the pandemic. And also, I think we learned from some of the lessons learned from the August 3rd in our resiliency as individuals and as Hispanics and as Latinos. What I want to know is if there are any strategies or any other kinds of individual resiliency factors that we can keep in mind since we do live in a binational multi-state region and preparing for the next pandemic, because we know that this isn't going to be the last one that we see. It was our first one, but it won't be the last. So are there anything that you can possibly give us in terms of what we can do for plan for the next one? And I'll start with you, Dr. Alozie.
I mean, there's a lot of things that are going to go into protecting ourselves from whatever the next one is. I hope, honestly, it's not in our lifetime, that this is our 1918 and we don't see anything again for 100 years, but it's unlikely. I think of all the things that I learned about 2020 is that communication is so critical. The ability to communicate openly, honestly, tell people when you don't know, and be wrong and admit it early. I think those are all great things. I think that too often, not just locally, but nationally and potentially internationally, people got bogged down in the dogma of I'm right, you're wrong. And the reality was nobody knew because we had never seen it. And egos got in the way of understanding that. And like you said, that information didn't get filtered to people in a timely manner. I would hope that what we've learned in our community is that we do have the ability to come together when we need to, that we do have the ability to get the information out and do amazing things as we're doing around vaccines presently. And I would recommend to anybody that's on the Plática and anybody that has the ability to influence how vaccines are distributed, if you know anybody that's hesitant, work with them, get them in front of somebody that can convince them. What I don't want to see is a situation where our communities of color are those hot spots where coronavirus becomes endemic and the rest of the world and communities around us that have different socioeconomic status typically are living their lives and doing what they want to. And all of a sudden it's a minority community that has consistent COVID in it. And so vaccines are the only way out of this. It's vaccines that'll give us the hope for tomorrow, allow our kids to go back to school fully, and allow our economies to recover and allow our borders to open. And so for me, that's the most critical job that we have over the next 6 months.
Thank you. Excellent. I tend to agree with you. Vaccines, definitely. Dr. González, I'll turn to you on that same question.
Well, I think that we need to concentrate in some part on the rescue of values that our culture has followed to make us champions in vaccine and immunization. It's impressive that in El Paso, Texas, almost all the vaccines for children are above 99% of coverage. We have an example. I'm going to take a minute. Measles in 2019, July. Measles, and Dr. Alozie can construct on this, tremendously because it's so transmittable. And, when we knew that something was going on with measles in our community, and the emergency came in, and as soon as we went and reviewed the information, the data of immunized population of Paso, we were 99% more. So we concluded all the event with 6 cases in El Paso, 3 cases in Juarez, and in 19 days, the outbreak was contained. In a settlement with 3 million people, with thousands of daily crossings at Paso, Las Cruces, Juarez, and that was it. So let's rescue those values and make them available and create educational tools in order to move our community into this path of vaccinating against this terrible disease.
Thank you. Excellent information. Elizabeth.
Well, I think it's hard to add to what both doctors have said, but
We're having audio issues.
hear me better now? Is this better? Yeah.
Yes.
So I'm saying that it's pretty similar, and I agree with everything that both doctors have mentioned. I think that when we look at a community like El Paso, that it's so multicultural, that there is so much, also we know that we are a predominantly Latino, Hispanic, Mexican American, Chicano community. But that being said, There's a lot of other fibers that are interwoven into here. I like to see us as a braid, especially because of our indigenous, herencia, that whole heritage. And speaking of the values that Dr. González is saying, when we look at migration and when we look at the Latin American countries, we know that there's a certain respeto, a certain very integrated respect to medical authorities, to lawyers sometimes, and to religious, to the priest or the pastors or what have you. So there is an already integrated confidence that a medical authority is going to help me. That if they're telling me I should vaccinate, then I should vaccinate. And those are the positive things that make us resilient, because we're looking for resiliency in our community, so that, as Dr. Alozie says, we flush out this pandemic and it doesn't become endemic to the lower socioeconomic areas of our communities. So I think some of our cultural values, some of the ways that we see the way that we need to protect ourselves, protect our families, is going to play a very large role in that whole connection that we want to bridge with communication, with effective health literacy, and to give people resources. And I think we've done a lot with that. We know that the foundations in El Paso are working tirelessly to do that. We know that the major medical systems, everybody is working towards the same goal. And sometimes it's hard for all of us to speak the same language and to even know what all of us are doing. But ultimately, when you pull up the blueprint of the resources that we make do with in El Paso, it's quite magical. It really is very powerful.
Yeah.
Definitely. Thank you.
All right. Susie, were we gonna
I think we're gonna let them do
closing comments?
Yeah, some final thoughts from each of the presenters today.
Yeah, let's do that. So let's do this. With the time that we have, I'm gonna ask each of our guest presenters to just take about a minute just to, share some final thoughts and, maybe add anything that you haven't had yet a chance to speak to, because I could see this plática going on for a lot longer, but in the absence of taking from your precious time, and we're so grateful for your being here, I'd like to just give you each a minute, and then Dr. Villalobos, I'll do the same with you, and I'll bring us home and make sure that we acknowledge our listening audience who has been so gracious with their comments. And I'll encourage our presenters, if you have a chance to visit our Facebook page. This recorded version will replay itself, and we'll keep it running continuously for several weeks, so we can have folks from other places listen in. And incidentally, while we have quite a few folks from New Mexico and Texas, I also see that we have some folks from other states as well. So that means your message is already getting out there, your successes are being told, your commitment to this work is being shared. So I'm going to turn to Dr. Fernando González, my esteemed colleague, who was so spot on about describing the binational efforts and the uniqueness to the Paso del Norte region, that I think we need to start thinking about a binational, global, international conversation on these issues, because of the fact that it is a global pandemic. But how does that look like when your global community sits across the river, verdad? Dr. González, take about a minute and a half to make your closing comments, and then I'll go to our other presenters. Go ahead, Dr. González.
I'm sorry, Fred, I have to cut in real quickly. I'm sorry, Dr. González. Dr. Alozie has to leave a little bit early, so can he go first? Do you mind if he has thoughts?
Very nice seeing you.
It's always a pleasure. Hey, I apologize, but thank you very much. I gotta run. I think all the things, truthfully, that need to be said, and at least in my mind, have been said. I'm proud of our community and how we came together. We went through a lot in 2020, and people count, right? They count the numbers, it's the cases and the hospitalizations and the deaths. And that's great. We need to keep, quote unquote, score. But there's a host of untold tragedies that befell our community from an economic standpoint. The fact that our border has essentially been closed, and people may say, well, why do you need a border open? We sit in the middle of a tri-national environment, right? Ourselves, Cruces, and Ciudad Juarez. We are a region. We're not one city or another city. And so shutting that down has been a tragic loss to people on both sides, multiple sides, whether it's the Las Cruces community, our own, or Ciudad Juarez. When I think about the kids, I have a 14 and a 9-year-old, and I think about the tragedy of them not going to real school since last year. I mean, I cried when my daughter went to school last month for the first time in a year. And again, is that communication. In the beginning, we didn't know. By the time we knew that kids weren't as affected in October and November, I just think as a community, we moved too slowly because unfortunately, the reality is this: the people making the decisions are like me. They have the socioeconomic means to keep their kids at home. They have internet. They have 2 cars. And so when you get people like that making the decisions, you lose the ability to be unbiased in the sense of in lack of equity. And so I think, again, that's one of those postmortems years from now, when we see the mental health effects on our children start to stack up, we'll wonder to ourselves the tragic mistakes we made around school were driving that. And so I feel bad about that. But again, I want to end it always on a message of hope. We've done an amazing amount of things. Super proud, as I've said multiple times now, with the vaccination effort that El Paso and this region has done. We just need more vaccine. If we get vaccine, we can give it out. If we tell people that all the time on state calls, we're like, give us more vaccine, we'll give it out. If you can't give it out to Tyler and other places in Houston and Dallas, if they have hesitancy, send it to El Paso, we'll take care of it. And so I'm excited about that. I look forward to a better summer and fall where we don't, where's my mask? Where we don't have to wear masks somewhere. It's probably in my car. Where we don't have to wear masks, where kids can play around again, and we can really enjoy and get back to hugging ourselves and being the humanity that we are. And so thank you so much for having me. I truly appreciate this opportunity. God bless, and we'll see you again.
Thank you so much, Dr. Alozie, for being here today. We always appreciate your wisdom and your experience.
I appreciate it. Thank you so much.
Absolutely. Thank you, Dr. Alozie. Good. Thank you. And I know you've got to go rush back out to do things that are important. So thank you, sir. Appreciate your time. Take care.
Right,
thank you for your service. Well, thank you, Susie, for taking note of that. And we're going to pick right back up with Dr. Fernando González, and so he can help kind of make his closing remarks. So, Dr. González, por favor, please.
Sure. Muchas gracias. Well, optimistic. I think that we are moving in the right way. We need to push the vaccine into our community. We need to reinforce the mental services, the mental challenges. We need to work on that. And we need to educate our community with what we have. We need to create sensitive materials, language barriers, all of those tools that we already have. Let's get them organized and send them directly to our community.
Definitely.
That message should be coined: educate, educate, educate. And you know what? You're spot on. In my work in the Latino community over certainly the last 20 years, you know what I hear people say all the time? Fred, we need more information. We want to be educated. We just need the information. And you think something as simple as that, some people are denied that information. So you're spot on, Dr. González. I'm going to quote you when I use that phrase: educate, educate, educate. So mil gracias, Dr. González. Elizabeth, we're going to turn to you for your closing comments. Then we'll go to Dr. Villalobos, and I'll bring us home.
Fred, you wanted me to speak about death, and I'm going to speak about death very quickly. It is my passion because life is my passion. And I have dedicated a good amount of my career to understanding death and dying, bereavement. I have become certified through the Association of Death Education and Counseling. And I never in my wildest dreams thought that I would be up against the situation that we all have been, especially as a clinician, dealing with so much bereavement and so much grief. And I can tell you that it is a part of our lives. It is universal. It is also very intimate to every one of us. But this is exactly why Dr. González's phrase of educating and educating and educating others about the fact that our quality of life matters, that we have the right and we have to use the dignity of who we are and the sacredness of who we are as human beings to preserve that and to continue and to acknowledge that, unfortunately, while death is painful, it is a transition that we will all be up against one day. And this is why we need to continue working. That's why we need all you soldiers and all the people who are behind every one of us in this community, in Nuevo Mexico, everywhere, as a humanity, to continue working to our quality of life, our existence, our purpose, so that when death comes, it is more graceful. It is truly the transition that we felt that it was because of a life well lived. And so I'm proud of our community. I'm proud of all the efforts we do, and I'm proud to be part of it. You know, I don't know what we chose to be in this mess, but here we are. We're going to make the best out of it. That's what we're going to do.
Excellent. Yes.
Well, that's right. Well, if there's an Adelita in my book in El Paso, you're her, by the way. So, gracias por todo que haces por nuestras comunidades, nuestras familias y para el mundo. You definitely are a saint in my book. Susie,
Yes, sir.
you probably have some comments you want to wrap us up with, and we're going to turn it over to you as our co-host. Thank you again. You're just phenomenal, and thank you for helping organize our guest presenters and working with your NALBA family, because you're part of our family here at NALBA. And so go ahead, Dr. Villalobos.
Yes, thank you, Fred. You know, I didn't realize how impactful these conversations can be, because I feel honored to have been a part of this panel with Dr. González, Dr. Alozie, and Elizabeth, in their knowledge and even imparting their words of experience. I learn something new every day. And that's what I tell my son: if you can learn something new every day, then you're doing something good. And I hope that the audience was able to take away some information that impact them as well. And as we move forward as individuals and our families, and as co-workers, as colleagues, and as a community, El Paso is always going to be that bright shining star on the mountain. And I hope everyone sees it for what it is. So thank you again for having me as a co-host, Fred.
Yeah, fantastic. You know, yeah, I'm very moved by what is happening in El Paso, and as Dr. González said, he spoke, and so did Dr. Alozie, to the fact that that part of the international border is very significant. It ranks as one of the top three most busiest uh, links between nations, because we're talking two nations and three states, and it represents something that's very unique. And I think, Dr. González, you left me with a reminder to start thinking about how we can engage in a binational global conversation as it relates to the Hispanic Latino community, which is global in of itself. But you reminded us that, particularly in Mexico, public health is a very strong system. Mexico, at various times throughout its public health career and system, has had higher vaccination rates than the United States. And we know that through our work with the U.S.-Mexico Border Health Commission. So thank you for reminding us of the things we already do well, can continue to do well, and then we can learn from them here in the United States. And I'll end with saying that there was some points that were made today that are really invaluable, reminding us that the areas such as the colonias, which are very unique and distinct to this part of the world, are very important to ensuring that education, and services are made available to populations who would have the least access to those kinds of bits of information and resources. And I think I'll say the following. What I realize is that when the expression was called El Paso Strong, was used very early on, I think it still applies today, to the strength of the people in El Paso for being able to endure, fight, and combat this infection. You all are guerreros and adelitas in my book. And I want to say thank you so much for being here today to educate all of us, including the live audience. And I'll end with this statement from one of our participants. Clarissa says, my daughter, who is 31 and had asymptomatic COVID, has made it her mission to get the whole family vaccinated. And she says, I'm so proud of her with an exclamation mark. She says, our elders are vaccinated. My generation is getting vaccinated. And hopefully my daughter's generation will get vaccinated soon. So with that positive note, mil gracias. Wonderful to have you all here today.
Thank you.
Saludos. Adios.
Yes.
Bye-bye.
And
Take care.
shout out to the promotoras out in the field. Thank you so much for your work.